Por... tú no entiendes que estoy viendo algo y voy a grabar algo.
I'm Larry Farver, and let's queer up health. Trump administration ends direct CDC HIV grants, shifts 46 million to states. The Trump administration has ended a long-running federal grant program that directly funded local organizations providing HIV prevention and care services, redirecting the 46 million through state health agencies instead. The Centers for Disease Control and Prevention's community grant program currently supports about 96 organizations that provide HIV testing, referrals to care, PrEP, doxy-PEP, and outbreak response. Under the change, states will determine whether those organizations continue receiving funding. However, AIDS United, a Washington, D.C.-based nonprofit, criticized the decision. CEO Carl Bologna of AIDS United warned that the potential impact. Quote, "We cannot end the HIV epidemic by dismantling the trusted community systems that make prevention possible. This decision threatens access to testing, PrEP, PEP, and care, and will ultimately lead to preventable HIV transmissions, program closures, and higher healthcare costs," end quote. Advocates also expressed concern that some states might not prioritize funding from community-based organizations serving populations disproportionately affected by HIV, including Black and Latino communities, LGBTQ plus people, and people in the South. Carl Schmid, executive director of the HIV plus Hepatitis Policy Institute, said funding decisions could vary widely by state, potentially delaying support for local organizations and limiting access to discounted medications tied to the federal grant program. Well,
so doesn't this essentially create, I don't assume it does, but it should. I have been in contact with like attorneys that claim to be supporting what is considered Title IX or like disability rights or employment rights in relation to living with HIV. Where are those attorneys in this circumstance? Because I've called some of them and they claim that they offer their time and their licensure to take on cases like this, but are they going to? I don't know. This seems like a way. We are living in a time where dictatorships and narcissistic personalities and abusers are literally being allowed to criminalize everyone but themselves. That's what I perceive in this. It's not just about giving money to states. It's about making it harder for people to even be able to exist. This is the true core of MAGA spirit. They are not making America better. They are making it worse. They are allowing people to take on vendettas against people. I know this because I have seen it personally where I am experiencing biases and personal attacks by people who claim to be Christians, who claim to be supporting the wellness and safety of people. But there are so many people who have a facade at their work, in their homes, and truthfully, in their core of heart, they are not good people. This does not make it anything better. So the entire ethos of MAGA it's literally a corrupt facade. There are so many things more important than whatever this is doing, and I have to believe that it's an attack on people for existing. So hopefully from now on, the facade will be breaking, because if people claim to supposedly provide a positive benefit, but they don't, then it's up to every single person in the country to rip up that facade, take off that fucking mask, and show your true colors.
there is so much that we have to look at with this November's voting, especially here in Florida and many other states like Florida. It's frightening and challenging to think that many of our fine nonprofits here could be impacted, and what that would mean for our community. What do you all think?
I mean, we keep seeing that the federal government's pushing it to the states and pushing it to the states. I'm wondering when it's going to be, you know, you're going to see mass exoduses of people out of certain states. Because, I mean, you're already seeing it with abortions. You're already seeing it with gender affirming care, that people are leaving their local areas, their states, to get the care that they need in another state. And then we're seeing people being witch hunted, and the doctors being witch hunted from the states that don't do the care for the states that do the care. And so now this is yet another situation where the government's going, okay, back to the states. This is what you've been wanting, so here you go. And now that money is going to sit there, and the state's going to go, we're going to put it in something else.
Exactly.
If you're lucky.
And I mean,
Just something else.
Yeah.
A new swimming pool at the governor's
Well, no,
mansion.
my point is actually like the Trump administration, this is not in a vacuum with how they've treated HIV and healthcare funding overall. You know, I was reading in Vox last week about how the future of HIV vaccines, and there was one of the scientists they were talking to. They were just getting ready to do an actual trial of an HIV mRNA vaccine. They had gone to Africa to start it, rolling out. As soon as they touched down, like a week or two later, Elon Musk and all the Doge people, they cut all the funding, literally collapsed the entire research project. We've been seeing these stories about HIV with this particular administration since he started. With this one, it's horrendous what could happen to people. This follows so many other problems with him doing all this. And also, we were talking about how this will affect people's prescription drugs. He's not just coming for people with HIV's prescription drugs, people. They want to get rid of Medicaid Part D, the prescription expansion. So any of you older people that voted for Trump, good luck. Good luck paying for your drugs, kids. That's what we're into right now.
And also to the point that White House don't only give these money to the states when the states agree with them, right? There's a recent report that at least 4 FEMA requests approved by FEMA, his FEMA, was denied from White House, from the Oval Office, because they're blue states.
Right.
They are withdrawing. They're withdrawing money from blue states to punish blue states, while giving red states governments essentially free money to base and to use ostensibly for other users, but it's going to end up benefiting only the people who voted red.
Correct.
It is a fundamentally government by favoritism. This is not government by equality or even equity. This is government by I like you and therefore you get more money.
Right.
I don't like you and therefore when you have a wildfire, I'm not giving you a cent to combat it.
Correct. And the problem is in 2 years' time, when we can actually try to do something about it, many of these nonprofits and organizations that give this care will have closed and folded, and to restart something is...
Has anyone actually made it to level 4 before? If you're slightly congested, use level 1.
lengthy at best. So the damage that it will do, not that it could do, that it will do, might not ever be.
Rex is touching on to one of the problems that a lot of activists get worried about, the concept of electoralism. And it's, one side can destroy so much and it takes so long to try and rebuild that you never actually get back to it. And it's a huge problem with American democracy right now, where it's like, if we don't fix it, I don't know how this country's staying together,
They're saying the right things, but honestly, at the end of the day, what this is about is it literally is an attack on the people just for existing. Essentially, if you don't give them moral or political superiority, whoever the dem is, it's as if you don't even get to exist. That is a form of murdering people without a gun. They claim to want safety, but they don't want safety for other people. They want safety for themselves. And so really question the moral character of every single person with a job in wherever this type of stuff is affecting negatively whatever communities, because it's somebody who maybe owns a house. It's somebody who works in a hospital. It's somebody who works in police. It's somebody who works in a city hall type of thing. It's somebody who has a law firm. All of these people that don't support positive benefits are voting the opposite direction. it's not enough to blame an administration or even a president. You have to look at everybody in your local area and take notice of who has a facade, who has good intentions, who has ill wishes. Because what I am living right now with this phone device is that there are people who truthfully don't deserve to be in the lives of other people, and yet they are forcing themselves, like a rapist, to be in the lives of other people through remote access viewing of phone screens. This is a tactic being done, and at least at this point in time, I have enough credibility that people actually believe that this is what's happening to me and that it is unfair. I have faced attacks on my credibility and my competency, and I have succeeded in retaining my intelligence because I am a kind person who does not believe in abuse. Who are the people that believes in abuse? The ones doing what I'm claiming is being done to me. I have no relation, no desire. My parents have no desire for this type of abuse to occur in our families. No one should experience this. They are truthfully living in some psychological cult abuse behavior, and no one should be subjected to their fucking bullshit.
It takes a month to take down an agency by Doge. The problem is that, to rebuild it, it takes, 10 years.
Yeah.
But the electoral problem is this. People expect it to go back up in a month. When Obama came into office, everyone is like, "Oh, you must fix everything that Bush did wrong." And if you did not do it immediately, then you're a failure. That's how we come up with. That's how. And of course, you also get enormous sabotage from bad actors like the Tea Party. They try to.
Who was that guy Mitch something? I think he might still be alive. Didn't he say the
I don't know.
entire-
It's a Schrodinger's Mitch McConnell at the moment. He can be alive and not alive at the
Do
same
you remember
time.
he said on day one it was to destroy Obama's presidency?
Well, at the same time, the right is allowing someone like a Pete Hegseth to request millions of dollars to continue the war in Iran, no matter what you think about the war. Also, to provide testosterone to the military at this time.
It's gender affirming care.
Of course, thank you.
Right.
It's almost like being in a cartoon in the world that we're living in right now.
I mean, just if everybody think about this. Think about your car, right? Your car works. It takes 1 second for it to die. And you take it to the shop and they say it's going to take a week. So use that analogy to think about all of our organizations out there. Our organizations that not just in HIV, but in everything that we're doing, gender affirming care and abortion clinics, when something closes and something dies, it takes longer for it to open. And because of our democracy and things changing every 4 years, maybe 8 years, by the time we get the ball rolling, something else comes in. So we need to prevent these things from closing. We need to prevent these organizations from failing to give care. Because what's going to happen is it's then going to fall on our hospitals and ERs. And so then those places who say, okay, we can't refuse you care, are going to then pick up the slack. And then where are those bills going? And your insurance rates, we're already complaining about insurance rates. It's not a micro situation, people. We are a global economy and it affects global concerns and affects us globally, period.
Exactly. And, to echo Larry's point about how much they're spending on that war, it just reminds you that if the government ever tells you they have no money for something, they do. And that's an important note. And there is no other queer nonprofit media platform like
FYI, people's medical documents are definitely being stolen by people in police, and that it involves breaking and entering. It involves organized burglaries between employees. Um, it makes me wonder if people learn about medical funding and then they decide that they have like they want to commit hate crimes against people existing, and then they're like, oh, we're learning about how people are able to have health care, and then they want to take that away. I do wonder if these evil, malicious, unethical, immoral, C-word and bitches, even the men are like that. because if it were to be in relation to what I am talking about, then there is such a bigger cultural crossroad that is occurring, and it is being facilitated through literal theft, like literal theft, and they're getting paid to do this. When everyone's saying that if healthcare was more affordable and accessible to everyone, then people would be better off. There are people who literally live their lives riding the coattails of other people when they are not that competent. But by sucking clit and sucking vitamin D, they get by. So I imagine that this has to do with uh, politics. And when did healthcare become so politicized? When did helping people become so politicized? Is that moral? Is it ethical?